the sport fraternity. Yes, a lot of things are happening, but then of course, as I keep saying, that our health is our priority, so we need to also take care of our health day in and day out. And right now, we're zooming straight into the Stay Alive segment, where previously I gave you something that we're going to talk about today that's concerning cervical cancer. And as we're in this month, we need to draw more awareness to cervical cancer. What can we do to prevent it? How can we treat it? And what are the things that we're doing wrong that could even make us prone to getting cervical cancer as women out there? So in order for us to have more education about this, we have a health expert here in the studios with us. She's a physician assistant and she goes by the name Josephine Bempong. She's also the CEO of Josey's Health Center, and she's here to educate us more about cervical cancer. So as we're doing this interview, I'm doing this with you, so any question at all that crosses your mind, do well to send it on our social media platform. Just go on Facebook at HSTV Live GH and let me know what you have to say concerning cervical cancer right here. Good morning, Josephine. How are you doing?
Good morning, I'm fine. Yourself?
I'm okay as well. So 2024 has started. I just want to take you back to 2023 a bit.
Okay.
How was your 2023 like for you, and what are you expecting for 2024?
Okay. 2023 was great. So I'm expecting greater things in 2024.
How did you spend your Christmas holidays? A lot of people went out, a lot of people also slept. What did you do?
I was basically sleeping.
Basically sleeping. You had to take time with your rest.
No, yeah, because stress does a whole lot of harm to the body.
Yeah, it does.
I really use the festive season for rest.
But you're looking good. You're looking good. You look well. I like your brooch as well.
Thank you.
Okay, quite interesting. So, yes, we all know that 2023 was a whole back and forth, and now we've entered into 2024. We need to be healthy as we're in this year. We need to eat right, and we need to take care of ourselves. So, let's just touch more on cervical cancer right here. And I know a lot of people have heard of it, but maybe some people don't even have the basic understanding of what cervical cancer is. So, first, I'd just like you to give us a detailed explanation of what you'd say cervical cancer is.
Right. So as you rightly said initially, we are in the Cervical Cancer Awareness Month, and then if you are listening to us, you are watching us, I would encourage you to pay attention to what we are discussing, because it's a very important condition to be discussed. And when you're talking about cervical cancer, it's a malignant tumor of the cervix. So I'm going to explain some key words in the definition. So when we say a cervix, is the lowermost part of the uterus, that's your womb.
That's down here?
Yes, your womb. So the lowermost part of the womb. And then when you talk about malignant is just the same as it being cancerous. And a tumor is a swelling of any part of the body that is not as a result of an inflammation, but just as an abnormal growth of a tissue. So the cervical cancer is such that there is an abnormal growth of tissue in the cervix, which is cancerous. And then the tumor is not as a result of inflammation, in a sense that when an inflammation happens, it's a localized physical condition of the body where it's as a result of a reaction to injury or an infection. So that part of the body is swollen, is reddened, is hot, is often painful. So there's a tumor at the cervix, but it's not because of an inflammation there, but it's because of an abnormal growth of tissue in the cervix.
And how does that come about, that so all of a sudden you just get this abnormal growth? Is it something that people do?
No. So it's such that cervical cancer is caused by human papillomavirus. So without the virus there, you can't say whatever that is happening there is cervical cancer. So for you to diagnose cervical cancer, there should be the presence of the human papillomavirus. So when the virus is there, it causes the cells to overgrow abnormally, and it will form a tumor there. So some people can have the virus and then it will be in their system, the immune system will fight it off, but it can also stay in your system for so many years and cause changes in the cervical cells over there. So you get
so if you're someone that let me say your immune system is not really that strong, then you could say that it's easy for you to get the cervical cancer.
Yes, it's easy for you to get it in the sense that your immune system cannot fight off the infection. So it will be in your system for a longer time. And then this HPV virus is gotten from sexual contact. So you might be someone who has multiple sexual partners, or you can have one sexual partner, but your partner will be having multiple sexual partners. So through that, you get infected with the HPV. It will stay in your system for long, and it will start causing changes in the cervical cells.
So what if, someone with multiple sexual partners, but then the person is protecting his or herself each and every time? Would you say the risk is lower or still you might stand a chance of?
Okay, if you're protecting yourself, you not necessarily just about getting the HPV virus, but if you have other sexually transmitted infections like gonorrhea, syphilis, genital warts, and all that, they are you can also get the HPV infection. So you get so when you get the gonorrhea, syphilis, the warts, the herpes, you can also get the HPV. I mean, they work around each other. If you get it, so you can be protecting yourself, but when you get, let's say, HIV/AIDS, you might get the HPV, then it moves on and on like that.
Oh, okay. So aside from, let's say, people with weak immune system, and then those also having multiple sexual partners, which other people would you say are prone to getting cervical cancer, or which age range would you say you normally see it happening?
Okay, so if you are sexually active and you are not protecting yourself, you will get the HPV and you get cervical cancer. But we should note that it's not everyone that gets the HPV gets the cervical cancer. But for you to diagnose cervical cancer, there should be a presence of the HPV virus. And then when you start early sexual activity, that one, when you start sex at an early age, you mean you'll be having sex, you encounter many sexual partners and you get the HPV, the other STIs, then you end up getting the cervical cancer. And when your immune system is weak, you're also at risk of getting the cervical cancer. And when you smoke, it is said that, I mean, according to research, women that smoke, the tobacco byproducts were found in the cervical mucus of those women. So when you smoke, it has a way of destroying your immune system, yes, and it will also make you exposed to this HPV and cause the cervical cancer.
Okay. What about drinking?
There is no linkage, but drinking reduces your immune system. So when you are drinking and you are also having multiple sexual partners, when your immune system is low, so when you get this HPV, it can't fight off the virus, and then it will stay in your system for long. It will build up, and then you will get cervical cancer.
Quite interesting. So to those of protection, they are really risking themselves by putting themselves
at risk of
in that.
getting.
Okay, quite interesting. But what are they going to be able to tell that, okay, I think something is wrong down there with my cervix area? What are some of the signs and symptoms you should look out for?
With the signs and symptoms, I would want to point out that what I'm about mentioning might not be just about only cervical cancer, because some of them might pinpoint to other conditions like pelvic inflammatory disease, cervicitis, endometrial cancer, uterine fibroid, so many conditions, because you would have abnormal vaginal bleeding, either after intercourse, bleeding in between your periods, or after menopause. You have foul smelling vaginal discharge, either it's watery or bloody, and that one can also be another condition altogether.
Wow.
You get it. So it's not really specific to, let's say, it's not just about cervical cancer.
Okay.
So when you have that, it can pinpoint to other conditions as well. So when you start experiencing that, maybe abnormal menstrual bleeding, your bleeding is more heavier than normal, it lasts longer than normal. It can be that you just have a menstrual disorder. It's not that you have cervical cancer. So when you start experiencing all these things, we would advise that you come to the hospital. We would run the test and get to know if there is a human papillomavirus present. Then we go ahead to do other labs to confirm the cervical cancer.
So you diagnose the person, since it comes with so many other symptoms that you can't really pinpoint it is cervical cancer. So at that point, that's when you run your test and diagnosis. So can you specify on how you go through these processes to test these people for cervical cancer?
Okay, so you come to the consulting room with the symptoms I mentioned earlier on, whether pain during sex or pain after sex, abnormal menstrual bleeding, bleeding more than usual, like bleeding after menopause, all those ones. So when you come, we examine you, then we ask you when the symptoms started from, your general health and all that. Then we have a pap smear test that we do. So we would examine you, we go to the mouth of the cervix, we scrape some cells out, we send it to the lab for testing. So when they come and they tell us, okay, there is this cells we are seeing that are likely to be cancerous in the future, or the cells that we are seeing are cancerous, then we now want to think about where the cells are. If it's at the outer part of the cervix, then we are thinking of squamous cell carcinoma. That's a type of cervical cancer.
Okay.
But if it's one that is in the cervical canal, where the blood from the womb comes through to the vagina, or where the semen passes to the fallopian tube to fertilize the eggs, when it's at that part, then we are thinking about adenocarcinoma. Okay. So those are the types of carcinoma. But we would wait for the test results to come so that we know what it was found over there.
Okay, interesting. So with all the cases that you've had, what would you say the worst case scenario when it comes to cervical cancer? Like, talk me through some of the stages, the beginning stage, the middle stage, and then the worst case scenario.
So in staging of cervical cancer, we have stage 1 through to 4.
Okay.
So stage 1 is just about this cancer being in only the cervix. So stage 2, 3 to 4 is when it's spreading. So it can spread to your bladder, it can spread to your rectum, it can spread to your lungs, to other parts of the body. So when you get to stage 4, that means there's a wide spread of the cancer cells.
Okay, interesting. But are there ways that, or are there some sort of vaccinations that someone can go through just so the person can prevent future cervical cancer from happening?
Yeah, there are vaccines. We have the HPV vaccines, but it's not widely available in Ghana. You can get some at Kolibo, I know of that. And as early as 8 years, you can get the vaccine. Even males can get the vaccine in the sense that it will protect them from genital warts, penile cancers, throat cancers, mouth cancers. You know, males too can get affected with genital warts and other STIs. So when you get the vaccine, you can protect yourself from those ones. But there is no approved test yet for checking HPV in males. So with the females, you do the pap smear test and you also do the HPV DNA test. So the vaccines, we have the Gardasil, we have the Cervix. Those are some of the types that you can take to protect yourself. And if you are sexually active, I would encourage that, one, you do the pap smear test to know if you have the cells that can be cancerous in the future, or if you don't have. And if you don't have, it's recommended that after every 3 years, you do the pap smear test.
Every 3 years. Okay, interesting. But definitely, is it going to have like any long-term effects on the person? What are some of the side effects that you'd see that these people are being affected by when they get the cervical cancer? Some of the side effects.
So with the cervical cancer, one, when you get it and it's not managed early, it's not seen early, you know, early detection saves life. So when you do the pap smear test and we know that, okay, the cells we are seeing are likely to be cancerous in the future, there are certain medications that we give to prevent you from getting there. So when we realize that you have cancer cells in the cervix, in the treatment modalities, we have surgery, we have radiotherapy, we have immunotherapy, we have chemotherapy. So in surgery, when we see that the cells of the cancer cells are only in the cervix, we have a type of surgery called trachelectomy, where we'll cut out the cervix or where the cancer cells are and surrounding tissues, then you are good to go. Sometimes you can do the cervix, depending on the surgery, depending on the spread of the cancer. It's either you cut the cervix and cut the uterus.
Wow.
Yes, and you can, that's hysterectomy, so your cervix is gone, your uterus is gone, and some of the surrounding tissues are gone. And when you are done with the surgery, you can add chemotherapy to it, where you are given strong medications to target the cancer cells. And we have radiotherapy, where there are powerful beams that are targeted to the cells to kill them. So it's either you are doing an external radiation therapy where the beams are directed to the part of the body where the cancer is, or you are doing a brachytherapy where a radioactive device is inserted into your vagina for some few minutes, to target the cells there. Then we also have immunotherapy, where drugs can be given. You know, when your immune system is there and any virus or bacteria enters your immune system, it's supposed to fight it. But cancer cells has a way of hiding from the immune system. So the immunotherapy helps your immune system to find them and kill them. So yeah, just
but is there what's the possibility that, okay, say my family members, a lot of them have had, cervical cancer. What are the chances that I'm also going to get cervical cancer?
Well, there you can. When you get cervical cancer, it's not like breast cancer that we say, when your mom gets it, you'll get it, that kind of thing, or ovarian cancer or something like that. But when you have cervical cancer, then every female is at the risk of getting cervical cancer. So it doesn't really have to be hereditary You get it? Every female has a risk of getting it. If you are sexually active and you're not protecting yourself, and you are not running the test to know, you know, these foods that we eat and the stress all over, our immune system, one way or the other, is not really up to the optimal level.
Okay.
Yeah, so you have to protect yourself. You have to take good care of yourself, and then you have to prevent the cervical cancer at the end of the day.
Interesting. But would you say it can affect one's pregnancy or one's fertility when it comes to that aspect as well?
Oh, yes, it can. Because if you get the cancer, and let's say your cervix is gone, your uterus is gone, then you can't give birth.
True.
You get it? So it really can.
But are there any lifestyle habits that you've seen a lot of women doing that is rather increasing their chances of getting cervical cancer? Something you've noticed with the people that come to your space?
You know, sometimes someone may not have multiple sexual partners, but just the one-time sex with someone, you got the HPV virus from that encounter.
It wasn't your lucky day.
You get it. So you didn't know, and it was in your system for long before you realized you got. So it's not really about promiscuity, like you are jumping from one person to the other. It can just be about one-time sexual intercourse, and then you got the virus, which stayed in your system for long. Your immune system was not able to fight it off, and then you got it at the end of the day. Sometimes it can be that you started sex at an early age, and that one-time sex also exposed you to the HPV virus. So for you to get the cervical cancer, there should be HPV virus.
Okay.
You get it. So anyhow you get into contact with it, either anal sex, oral sex, vaginal sex, or any sexual contact, when you get into contact with the HPV virus, you might get the cancer, because I was saying that it's not everyone that got the HPV got the cervical cancer.
Okay. So how often would you say that as a lady you should move into the health space to get yourself checked when it comes to all of these cancerous diseases? How often would you say we should move in there?
Okay, with the cervical cancer, I'm saying that you can do the pap smear test. So when you do it this year, and then we tell you that it's normal, every 3 years you can do it. But I'm also saying that when you get other sexually transmitted infections like gonorrhea, syphilis, and those ones, you can also get the HPV. So when you're done with the pap smear test and everything is fine, once in a while, you know yourself, you know the things that you're doing. So once in a while, you can be screening for the other STIs to know that everything is fine.
So let's say I've gotten the cervical cancer. How is my life going to be like in 5 years? How is it like for these patients with cervical cancer? I mean, after they go through this chemotherapy and then all of the treatment options, definitely is going to have a toll on their health aspect as well. So how is life like after, say, 10 years of treatment, or how long does even treatment take?
Okay, there is a survival rate for them. That's what I'm saying. That you have to get to know the condition at the early stages. So when you get to know it that you have cervical cancer, which is just at the cervix, you can cut it off. And after the surgery, you are good to go. Sometimes you do the surgery, add the chemotherapy to it, then you're fine. So with these patients, what they need is support. You know, going through surgery after surgery, and you know, going for chemotherapy sessions is not an easy thing. So they just need the family support, friend support, because we the health professionals will do what we are supposed to do for you. We'd encourage you at every step of the way, but you also need your family support to go through it.
Okay, interesting. So we've learned a lot concerning cervical cancer, and I'm hoping that we can learn more as time goes on. But then, is there any last advice you'd have for the women out there, what they should do concerning cervical cancer? Anything you want to say?
Right. So if you're a lady watching me, I would encourage you that you get a pap smear test done, because that one can help. It's a preventive tool. It can help us know the state of your cervical cells. So it will tell us whether you have a normal one, or maybe the cells there are likely to be cancerous in the future. So if you've not done pap smear test, I will encourage you to do it. You can see me, I'll do it for you.
Of course.
Then if you are sexually active, I would advise you to, in as much as possible, stick to one person, one sexual partner. And then if you've engaged in multiple sexual activities over a long period of time, come to the hospital, screen for all the STIs, and do a pap smear test. So once we get to know there are some changes going on, there are treatments available that we can give you. And then you can also get the vaccine to also protect yourself. I know that you can get some Akolibo. So you can, if you're 21 years and above, I mean, you should be doing what I just said right now.
Okay, interesting. I'm hoping that my viewers are going to take this advice. So, Josephine, for them to get into contact with you, put out your information where they can find you.
Okay, so my number is 054-830-6592. So you can contact me on WhatsApp or on social media handles as Josey Health Corner, Josey_Health_Corner, Instagram, TikTok. I mean, yeah, you can contact me on this.
Okay, thank you so much for coming in today, and I hope you have a good day the rest of your day.
You too.
Okay, so that was Josephine Bempong, a physician assistant from the Josey's Health Center. We're talking about cervical cancer, and as she said, I'm just hoping that my viewers should be able to pick one or two things, and then we can also be healthy day in and day out. But this will be wrapping up the Stay Alive segments, and of course, we have more interesting interviews coming up soon. So keep watching Healthy Morning. We'll be right back.